Hello, everyone. Dr. Mandell here with you. Good morning, good evening, wherever you are worldwide. I want to say hello and welcome to a great program, a program that I'm sure everyone out there worldwide would want to know more about this particular topic. It's all about over-the-counter medications, and we're looking at which of these meds we're looking here at the Advil, Motrin, or Aleve, or Tylenol is best for back pain, neck pain, arthritis, joint pain. I'm going to explain to you real simple. Most people don't understand this. They're taking the meds because the doctor says take this, their friend, their family, their loved one, maybe their pet. Just kidding. So this is really important information. So if you're having chronic pain, we all have taken probably both of these, acetaminophen. Acetaminophen, if you look to the right, we're looking at Tylenol. Acetaminophen is separate than the other non-steroidal anti-inflammatories. If you look to the left, the reason I broke this picture down, you see the three of them to the left. Those are the most common non-steroidal drugs, non-steroidal anti-inflammatory drugs. Those drugs basically are there to reduce pain, but they're also designed to do something that Tylenol does not do. Well, let's look. Tylenol does reduce pain. Yes, it does. The Advil, Aleve, and Motrin has, particularly Motrin and Advil, have an agreement. Ibuprofen, we all heard of ibuprofen because they sell ibuprofen, which no name on it, no Advil, no Motrin, this is ibuprofen. That is the same exact thing as Advil or Motrin. Let's understand that. Now, Aleve is naproxen. Naproxen is not the same. It's not ibuprofen. Naproxen is in Aleve, and it's different than Advil or Motrin. But the Advil, Motrin, and Aleve all are non-steroidal anti-inflammatories. Now, what makes these particular drugs different than Tylenol is that it has anti-inflammatory effects. Tylenol has no anti-inflammatory effects. So the golden question is, what is better to use for joint pain, arthritis, inflammation, neck pain, joint pain, herniated disc, inflammation from a bulging disc, low back pain, sacroiliac pain, hip pain, knee pain? It's inflammation. So there's your answer. Your answer is you don't want to take Tylenol for inflammation. Now we think of Tylenol as like a toothache, a muscle ache, maybe cramps. But I just want to mention something really important regarding acetaminophen, Tylenol. Science does not know exactly why or how this thing works, but it works when it comes down to reducing pain. It's good for reducing fever. But again, so is ibuprofen, so is Aleve, so is naproxen, so is Advil. They're good for pain. They're good for reducing fever, but they're also good for reducing inflammation. So the millions of people out there who have inflammation, the first thing in my mind is, how do I get rid of the inflammation? Tylenol, which is acetaminophen, is not going to take away the inflammation. Now realize ibuprofen they know how it works. It blocks the production of prostaglandins, and these are substances that the body releases in response to an illness or an injury. And the prostaglandins causes the pain and the swelling and the inflammation. So we already know that inflammation causes swelling. So don't we want to do something for the swelling? Well, there's your answer. Because millions of people are still uncertain when they should take this. Now, another important thing I want to mention about acetaminophen. There are so many medicines that you maybe take that already have acetaminophen in there. And a few of them are Actifed, Alka-Seltzer Plus, Dristan, Dayquil, Midol, Mucinex, Robitussin, Theraflu, Vicks. There are so many different ones. I don't want to go through all of them, but there are so many drugs that already have acetaminophen in there. So that's okay if you're taking that drug, maybe for a sinus or something, maybe for the pain. But I just want you to look at the ingredients because acetaminophen is a key ingredient in Tylenol. But acetaminophen is good for fever. It will bring down fever and it will take away pain. But it's not going to take away inflammation. So I'm the kind of guy that likes to say, hey, if you have a problem, you need to get to the root of that problem. If it's inflammation, if it's prostaglandins, if it's swelling, don't take Tylenol. Now, I'm not going to tell you what you should and should not take because I haven't evaluated you, but I would tell you that talk to your doctor. Your doctor needs to know this too, because if your doctor is recommending something for your pain, Tylenol, say, doc, isn't this inflammation? Isn't this a pinched nerve? Is Tylenol going to be as good as ibuprofen? You want to ask them these questions. So now you have a little bit of education, and that's why we're here for. So the important things about acetaminophen taking too much can affect the liver, and ibuprofen, which is your Advil, Motrin, or naproxen, which is an Aleve, those are all non-steroidal anti-inflammatories, that affects your kidneys if you overdo it. But obviously, the other thing I want to mention regarding Tylenol will not upset your stomach or cause bleeding in your intestine, but non-steroidal anti-inflammatories too, like aspirin, okay, Advil, Motrin, Aleve. Some of these are enteric-coated now where they have coating on them where they don't irritate your stomach and it slowly releases in the body. I think that's actually better. But the key thing for everyone is to make sure you have food in your stomach when you take a non-steroidal anti-inflammatory drug, like these ones on the left side. Okay, that's why I separated it, because I'm grouping those together as non-steroidal anti-inflammatories. And on the right side, we're just talking about acetaminophen and Tylenol. I really hope that that gives you a lot of education, because that is so important. I'm not going to go into dosages because depending upon your condition, it may be a different dose, and that's dependent upon your doctor. But in general, Tylenol is about 500 milligrams. In general, ibuprofen in an Advil or a Motrin, I believe a couple hundred, 200 milligrams. And in the Aleve, generally 220 milligrams, give or take, depending upon the dosages. But I'm not going to go into dosages because I don't want to diagnose someone I don't know who their condition is or what their past history is, or maybe has a past ulcer. So do your homework. I really think that this will help you a lot, particularly if you're suffering with a chronic neck or chronic knee or hip, and you're taking Tylenol and you're saying, wow, it helps temporarily, but it's not getting better because it's not taking away the inflammation. Because the ibuprofen and the non-steroidal anti-inflammatory drugs will help reduce those prostaglandins. And I think that's really, really important. So anyways, I ask you out there to subscribe. If you have not, check out my channel, Motivational Doc here. Many great self-help videos, hundreds. Most are geared towards spinal-related conditions, poor posture, forward rounded shoulders, lots of great self-help. Actually, great nutrition. We've really been getting a lot of great feedback on nutrition. And check me out, if you don't mind, over on Facebook, Motivational Doc over there. Go ahead and write what you like. I appreciate that as well. I appreciate the chat room for being filled up today. And I really hope that this information really helps you a lot. Please share this. There are millions of people that can really use this education. Everyone out there, blessings to you and your family. Make it a great day. We'll catch up with you real soon. Bye-bye now.